Hi, I'm Clarissa Mosley, psychologist, psychotherapist, and director of Calm Mind Psychology. Today we're talking about an incredibly important topic, that of depression. Depression affects so many people in this world. It has in fact been called the leading cause of disability today. So it's really important for you to be able to understand what depression is and first to be able to identify it. Are you suffering from it? Do you know someone who is? And is it major depression or is it one of the other variations of depression? So if you hang around through this video, you will understand all of that. And if you move forward into my series, you're going to understand an awful lot more about depression, about the physical, about the psychological, about the treatment, about the risk factors, and about how it affects friends, families, and relationships. But for now, let's go into understanding a whole lot more about depression and starting with the signs and the symptoms of depression. Let's dive in. Just about everybody will experience some form or period of depression in their lives. And if you don't, you will know someone who does. You can see how important it is to be able to understand the signs and symptoms of depression, and that's what we're going to be exploring in this video. So let's move on. What is depression? I really want to tell you that it is a descriptor. And because we are all very individual, our depression can show up in different ways, in different clusters, and come from many different reasons. Often those reasons are very hard to work out, and that's why the first thing we do is distinguish sadness from depression. Now, obviously, when you're depressed, you're sad, but what makes it different is that when we are sad, usually it's temporary, and usually we know why. Something happened, we lost something, we didn't get something that we wanted, we've just ended a relationship, somebody's just died, we've lost a pet, life's not going the way we want it to. We have a reason for our sadness. And it's usually time limited. We're sad for a while and then we recover and we get back on our feet and off we go. Depression lasts. In order to be diagnosed with depression, with clinical depression, you have to have at least 5 of these symptoms present for at least 2 weeks. I also want to point out, as we go through these list of symptoms that are in the Diagnostic Statistical Manual, Edition 5, also known as the DSM 5, as the gold standard for diagnosis in the psychiatric world, that the first lot of symptoms that I've listed in the order that I have are all what you could call psychological symptoms. But the other half of them are physical symptoms, dropping a pin in that because we're going to be talking about that in the next video. So you have to be sad. You have to have a persistent low mood, and this has to be present in the diagnosis. You can't pick and choose from the other ones without having this one here, and including the loss of interest or pleasure in normal activities or favorite hobbies. So this is going to show up in a way where you might have loved reading and now you can't pick up a book. You may have loved going to live shows. Now you either don't go, or if you do, it's like, it's just lost the joie de vivre in life. There can be feelings of hopelessness, worthlessness, and unreasonable guilt. Depressed people will apologize constantly for their existence. For anything they do, there might be a sorry that comes along with it. They may feel within themselves that they are a burden, that maybe their partner is better off without them, that there was somebody else out there that would make them happy. So there is this feeling of guilt, and this feeling of guilt can also go into the rumination that we'll talk about in a minute. When you're depressed, you can't think well. You've maybe got a foggy brain, and I want to put a little drop pin in that because we're going to be talking about that in one of the videos moving forward when we're looking at the physical causes of depression. But there can be a lot of brain fog or just this feeling of not being able to make a decision. I'm going to add in some little bits that I've seen in my clinical practice that aren't actually listed on the list of symptoms in the DSM 5. And one of them is a sense of overwhelm. I'll often have clients come in and they're like, I don't know what's going on with me. It never used to be a big deal for me to do these things. I used to be able to get up, put a load of dishes on, a load of laundry on, take the kids to school, go pick up some groceries, and then get into some work. And now I am absolutely overwhelmed at the mere thought of doing one of those things. So that can be one of your first signs that there's a depression lurking, is that you just go to do something you normally do and you feel absolutely overwhelmed by it. Perhaps you don't want to do it. Perhaps you withdraw. And these are things that you may not be aware of because depression can sort of move in like a big grey fog. So another thing that the DSM doesn't exactly describe, but I want to pop in the diagnosis list, is anxiety or constant worry. So anxiety and depression are very close bed buddies. So they're often found together because the low mood and the depression and the neurotransmitters and the other stuff that are going on that we'll talk about later can cause this sense of unease. So the person can worry a lot about things. There can be a bit of anxiety that can show up at nighttime. You can be tired all day and then at night this anxiety feelings coming up, but it's more accurately often termed rumination. Now, rumination is the act of chewing over something endlessly. It's like a ruminating cow. They chew on their cud. And so rumination is where the person will constantly obsess often over what has happened in the past. That will go around and around. If you're the sufferer, it'll go around and around in your head. What you did wrong, what you should have done back then, what that person said to you, what it meant to you, past relationships often, all of the stuff that's happened in the past will become bigger than Ben-Hur, and it will become a source of constant thinking. Now, this isn't always present in depression. Sometimes there is just like flatness and a desire to sleep a lot, but often it is in the more amped up, irritable kind of depression. So a couple of the other things that aren't listed on the DSM-5 that I've found in my clinical practice, other than the sense of overwhelm, is the irritability. Now, when we are down, there is usually often a neurotransmission and a brain depression, like it's actually in the functioning of the brain. The depressed person is not acting from their best self, they're not acting from good decisions, they don't have much self-control, and irritability is part of being low and feeling awful. So in women, the irritability shows up as irritability. She might be called moody. And in men, something I want you to know is that men can be irritable, but they can also have fits of rage. So it's not true that a depressed person is completely phlegmatic and down and depressed all the time. In men, it can show up very much as you maybe won't notice a lot, but there'll be these anger outbursts. Depressed men can have outbursts of rage. And in depression, we can often find a lot more physical symptoms, aches and pains, digestive issues, headaches, and these, again, drop pin in them because we're going to be talking about the physical aspect of depression in the next video. So you've got fatigue and a loss of energy. This can be accompanied by either sleeping an awful lot or having insomnia. So the insomnia can be difficulty getting to sleep and can be difficulty staying asleep. You might wake up at 4 o'clock in the morning. Thoughts could be going around in your head. You could be just awake. You don't know why. You can't get back to sleep. Or it could be the other pattern where you don't go to bed. You don't want to go to bed. You're not tired till 1 or 2 in the morning, but then you're going to sleep till 4 o'clock the next day. There'll be a significant, like 5% or more of the body weight lost or gained. For some people, when they're depressed, they are not interested in food. And this goes along the line with the first two symptoms of the loss of pleasure and interest in normally enjoyable activities. So food takes on a quality of cardboard. There is no joy that you get from eating your favorite food. Maybe you just shove things in your mouth. You might be still eating, but it's just oh, I suppose I better. It's often a sign if you're not eating normally and it's been going on for a while and your weight's going down because you have high cortisol also. Most people have got, depressed people have got high cortisol. Again, I'm going to go into this in depth in the next video on the physical signs and symptoms of depression. But that cortisol for some people can make them lose weight because it's got an adrenaline factor and you're not eating, your appetite is gone, or it can make them gain weight. And often the weight gain goes with a change in how you're eating. You might be eating really badly. There's something about depression where the whole self-care and what's good for you just goes out the window, and frozen meals or pizza or grabbing for another bag of chips is all you can manage to do, and it's just going in the mouth. You might be comfort eating. You might be feeling like you're pushing the sadness down. It might be self-loathing eating, but it's just creeping around like a black cat in the back of my video. The next one is that you are slower in your movement and your speech, and it's something that other people can notice. So when depressed people come into my clinic, I can see in their body movements and their speech, particularly when I've seen them months later when they're feeling better, I can see the difference in how they speak and how long it takes them to respond. There'll be, maybe you'll ask them a question and it'll be like, I think I went to, it'll be very slow and protracted, and the movement, the body is often, you can see the depressed person, the body is slumped and there's a heaviness. They look heavy. So this is something that you may not be aware of if it's in your own body, or you may be. You might also be feeling a restlessness in your own body. And the last one is the depressed person who's having a major depressive episode may also be thinking of death, of that that life is not worth living, that they are such a burden on people, that the world would be better without them. This kind of thinking can just happen, and the person knows that they would never do anything about it. Often there is that lack of energy will inhibit making a solid plan or actually having the momentum to move into something that drastic, but it needs to be paid attention to. So if you've got someone who you know is suffering from depression, someone close to you that you love, there is no harm in asking them how they're going, what's going on for them, and to gently feel around if it's that bad. How bad is everything? How bad is it? Like, do you have thoughts sometimes where you just wish you weren't here? You can phrase it in a way that is not like, are you thinking of killing yourself? Please don't do that. It's hard enough for the person who's depressed, being depressed, feeling that low sense of self-worth without feeling that they are burdening someone with this issue. But there's no harm in you asking. And then if they do say, yeah, actually, I think about it all the time, please get them to your nearest health professional. I've put some resources down below in the links. They are pretty specific to Australia, unfortunately, but each country has got an emergency number. Each country has got a mental health hotline or something like Lifeline where you can call up. And each country, you should, if this is a case with yourself or someone that you live with, then please find yourself the appropriate people to reach out to. So again, just an overview. Here's all of the symptoms of depression from the Diagnostic Statistical Manual of Disorders, edition 5, the DSM 5. You need 5 of these, including the first 2, present for more than 2 weeks, to win yourself a diagnosis of clinical depression. Everything happens on a continuum, on a spectrum. And so you can have the major depressive disorder, you can have some of those symptoms in a milder way, and you can have people that have got them really badly. People that have got to the point where they can't get out of bed, or they don't shower, or they don't feed themselves, or their animals even. That's how bad major depressive disorder can get. So we talked a little bit in the beginning of the video about how we can distinguish depression from sadness. But the other question is, what about grief? Well, we used to not diagnose depression when there was grief present, but now we do. And it's not that there is a specific time when grieving should end, but depression can go alongside with grief. You've lost someone incredibly important, and there is a normal mourning and grieving process that can take as long as you need it to take for you. But then if you get a bunch of those other symptoms showing up, the person is so low that and we're talking, sometime afterwards, not immediately afterwards. If someone's just lost someone, then, they can stay in bed for a few days. But if this is happening a few months down the track, the person's not eating, they're not getting up from bed, they're not having showers. A lot of people, when they're deeply in depression, will lose their personal hygiene habits. They won't have a shower for days, they won't get dressed, they'll be wearing the same sloppy joes and track pants, hair unbrushed, teeth unbrushed. They actually get to a low point where they're not even taking care of themselves. So that is not normal grief if that were happening. It's not normal grief to have the slowed down speech and thought, to have the rumination or the constant feelings of oneself being worthless or hopeless or a burden. So depression can occur after grief, after a loss. It can also occur alongside PTSD. Obviously, if someone's had a hideous trauma in their life, they don't necessarily always get depression or anxiety, but they certainly can. ADHD. At least 1 in 3 people with ADHD are going to experience depression. ADHD is a neurological disorder. I don't like using the word disorder with ADHD. It's, you're just wired up differently, and there are certain parts of the brain that don't function at the level that other people's do. And these different areas govern emotional regulation. And so also, along with ADHD, the difficulty in organizing life and tasks can lead to the sense of low self-esteem, are also compromised and diminished. So depression is often found at some point in time in somebody who suffers from ADHD. Depression is also often comorbid, which is a beautiful word for being alongside other psychiatric conditions, personality disorders. Someone with borderline personality disorder, for example, will often have periods of depression. Certain medications and illnesses can lead to depression, so it might not be depression proper. It could be the result of long-term cancer treatment. Certain well-known illnesses also have depression as a symptom. Hypothyroidism, low vitamin D, and sometimes even low iron. So if you're going into the doctor with your symptoms of depression, hopefully they'll do a full blood panel to actually rule out any of those other things before they give you a diagnosis and send you to a psychologist or for getting medication. Now we are going to talk about treatments, we're going to talk about risk factors in the subsequent videos, so I hope that you'll stay on and watch through. But I also hope that you've enjoyed this in terms of assessing whether or not yourself or somebody you know might have one of these many forms of depression. So if you did enjoy this, please hit like, please subscribe, and please hang in there and watch some of the other videos I have in this series, because I've got some really interesting things to tell you. Okay, so shall we move on?